Health Links is an effort to recognize patients who have chronic illnesses, multiple chronic illnesses. The system doesn't serve them well. In fact, they represent about 1% of the population, but they also represent about 50% of the cost. And it's not them causing the cost, it's our system fails them. And the Rural Hastings is a prime example of how this has come together extremely well in meeting the needs of these patients.
Most notably, I think the System Navigator has been I would say that has been the intervention that's made the biggest difference and has helped people the most and has been the most patient-focused. And certainly from my perspective, that's our biggest success to date.
Anne and Diedrich are the couple that we're going to see. Diedrich and his family originated from the Bancroft area. In fact, in the home that we're going to be at, Anne was from the States, which has been really good, I think, in many ways for Diedrich, but for Anne, it meant that she left behind a lot of her previously established supports and connections and health team.
And the System Navigator's role is to take all the perspectives in the patient's care. So the doctor's perspective, sure, the nurse's perspective, but most importantly, the patient's perspective, the patient's family and circle of friends, and get a sort of an overall view of what exactly is going on and why this patient is not doing well.
The patient that we're seeing this afternoon has had multiple specialists, multiple diagnostic investigations, and it's that set of eyes that's watching for, okay, I spoke with physician X last week, I know that that report should be due this week, so I'll flag it. That helps the patient to meet their needs and helps reduce the time and the demands on the primary care practitioner.
Yeah.
The System Navigator has been revolutionary to my practice in that it affords me the opportunity to not worry about some things. You know, to sort of not have questions. Gee, I wonder what's going on at home. I wonder, you know, what this person's resources are. So basically, I put that in the hands of the System Navigator.
I couldn't see a rheumatologist for a year. And I have arthritis very badly. I've had it since 1989. And I was under a strict doctor's care in the States with my arthritis and with my other issues.
The vision really is that when I get to the age, let's be selfish here, you know, when I get to an age or stage or have an event that I require services, I would like to know that I have somebody I can go to that's one person that I don't have to tell my story 5,000 times to, and have them actually listen to me from what's important from my perspective, and do what they can to act on my best behalf.
People asking you, what can I do for you? And then it's like you tell them and nothing's being done. And you hate to be on the phone and calling them because you know they're busy and they have other patients to take care of. And so what you do is you just kind of give up. And that's where I was the day that I was introduced to Sherry.
So I think I'm most proud with the Rural Hastings when I hear patient stories. And I hear the little things that the System Navigators are doing for patients that are making a big impact. We start every meeting with a patient story, and it could be little things like, you know, getting a light bulb changed in a room to getting a book for a patient that they were really interested in reading. So it's really building relationships up with patients that I think is the most valuable piece that we've done.
She got a potty chair for me. Can you believe that? A higher raised potty chair. And I had asked for that and asked for that and asked for that, and it was like, can it be done? Is there such a thing? And finally, it came, and it was because of Sherry.
But the simplest interventions of installing a higher profile toilet seat means independence, and it means an improved safety to do a basic function that we all take for granted until we're not able to rise and get to our, you know, the destination safely. The outcomes could be far, far different. You know, either premature hospitalization, long-term care placement as a result of a fall and a fracture, or worse. You know, those are just some small examples.
So So what we're doing is we're making people healthier and we're keeping them healthier so that their health doesn't deteriorate to the point that they have to go to the hospital or that they have to go for those specialist appointments, or at least so they don't have to go as often.
Can we book Mr. Smith a chest x-ray?
Yes.
People who live in the city, an x-ray is just an easy thing to do. Go to the lab to get blood done. That's easy. It's not easy here, right? It's a 45-minute drive, and most people, even people who do drive, that's an hour and a half in the car and gas money, and a lot of people can't afford that.
But we demonstrate that 100% of our clients have social impacts as well. And our system navigators and probably our physician talked about, we have to address those social concerns before we can impact the medical concerns. So one of the things we've looked at early on is how the Health Link or the care plans and the System Navigator have impacted hospital utilization. This time, the 240 care plans that we represent here have netted a savings of almost $3 million.
So I hate to think that we need to think about this in sort of financial terms, but that's a reality. The docs and family health teams and family health groups are working extremely hard, and they have tremendous financial pressures. And that is another way I think that the whole System Navigator role can be sold.
We need to transform how we're investing in healthcare. It's not necessarily that anybody is asking for more dollars, it's a redistribution of the dollars, even to provide equity to people who just can't access what there is.
We have $1.1 billion, as I said, that we spend in the Southeast. We need to get better value out of that $1.1 billion. And this is a prime example of how to do that.